Delighted to welcome our next guest now, Housing, Communities and Local Government Secretary Robert Jenrick. Good morning to you, sir.
Hi, good morning,
Good
Julia.
morning. Now, you're announcing this morning that police forces and local councils are going to receive an additional £60 million to step up enforcement of coronavirus rules. What was that? What is that money going to be aimed at them actually doing?
Well, we want to help local councils to continue performing their critical role of advising, engaging and educating members of the public. So they're going to be choosing different things for different places. In some parts of the country, they might be sending out council workers to advise people in the nighttime economy to stick to the rules. In other parts of the country, they'll be going to small businesses, helping to make sure that they're following the track and trace proceedings. If they've got issues or they're confused, giving them advice on how they can follow them. This is a soft approach. It isn't a sort of authoritarian COVID marshals. It's about having community champions and ambassadors and wardens, people welcoming people into public spaces and making sure that they're safe.
The high-vis jacket clipboard people telling us what we're doing wrong and doing right. You're talking about a soft approach, but at the same time, we know that the government, well, we're told in one paper today, the government's already signed off on, but it's certainly very likely to, if they haven't already signed off on, a much tougher approach of closing down pubs and restaurants across large swathes of north of England, just as Nicola Sturgeon has done for large parts of Scotland because of rising cases. Can I ask you, have you been out to a restaurant or a pub since July the 4th when they reopened?
I certainly have.
You have. You've done that regularly, presumably to help the local economy in your constituency. Have you been to a single pub or restaurant where there has not been social distancing happening?
I have been to pubs and generally speaking, they've done a fantastic job.
Has there been a single pub or restaurant that you yourself have been in that did not follow the rules with social distance, hand hygiene and all of that? Has there been one?
Well, I think the pubs and restaurants I've been to have been doing their absolute best to follow the rules.
So they have been following the rules, or
Julia,
have they not?
They have. But
they have.
Julia,
Okay, so no. I just want to establish because I've been out to pubs and restaurants since July the 4th, and I've not been in one that's not been following the rules. So why are we closing down pubs and restaurants that are following the rules and not a risk to anybody?
Well, because it's commonsensical that if there's a virus that transmits through personal contact, the more time you spend indoors with other people, the more likely it is that the virus is going to pass from one person to another. And the more drinks that we all have, I think for some people, that makes it less likely that they follow the rule. I think that is common sense. We're not an outlier in coming to that view. That's a view that's been taken by a number of other countries with good responsible governments, places like Denmark, the Netherlands and Austria. Many parts of Europe are actually going further. So if you were to go to Paris or to Brussels, they've taken further steps limiting access to hospitality. Now, I agree with you, Julia, that neither of us would want to see these measures in place for a day longer than is absolutely necessary. But the advice that we receive are that they do make a difference to helping to limit the amount of...
But you said a virus that transmits indoors. Obviously, we should limit that the spread of people, being indoors with each other. But the government had a policy, and I believe quite rightly, to get people back in their workplaces for a period of time. And so as well as I do, I'm sure that if you look at the actual rates of transmission where people are getting this virus, most infections happen at home. By a long way. Next, it's been just recently universities reopening, obviously young people in halls of residence, which effectively are their homes, and then it's hospitals and care homes, and after that it's workplaces, and then a very, very, very long way down the list it is pubs and restaurants. So why are we closing pubs and restaurants?
Well, we are taking a proportionate approach, which is trying to prioritise education and employment. So it's right that we try to keep those settings open as much as we possibly can. None of us want to see pubs, restaurants and cafes operating on limited hours, or even, God forbid, that they're actually closed altogether, as is happening in some parts of Scotland. But we do have to take action here because the rise in the number of cases is very serious in some parts of the country. It isn't in all places, and that's why we're taking a localised approach. If you were in Manchester, the number of cases per 100,000 is over 500. If you were in Dorset, it's 19. So there are big local differences, and that's why we have relatively simple national rules, and we're doing all we can in local areas to clamp down on the virus and try to stop it spreading.
But we're told that this is regional and proportionate. But we know that local leaders in Manchester, Liverpool and elsewhere, they've been saying, please, can we have local power? So, for instance, we can close down the pubs that aren't enforcing social distancing, which they currently can't do under the law. Let us be enforcing things on a local basis. We can, direct things. We can do local track and trace, local public health workers getting involved, and local licensing as well. And we can get on top of this. But these blanket measures aren't working. Now, we know they aren't working, as Keir Starmer pointed out, the Labour leader, during PMQs yesterday. 19 out of 20 of the areas which have had local lockdown measures, some of them since August, for goodness sake, a long time, time enough for them to work if they were able to work, have seen infections not just not going down, they're going up at a higher rate. When are we going to actually have some evidence-based policy making when if a policy doesn't work for weeks and weeks on end? That's not an argument to extend the policy, that's an argument to drop the policy, isn't it?
No, that's not correct, Julia. The measures we've taken locally undoubtedly do reduce the rate of transmission.
How?
Now,
they haven't.
no.
I mean, the data shows they haven't.
No, that's not correct. The data shows that they have not yet had the impact that we would like them to have.
When will they have the impact?
But if we hadn't taken the steps that we've taken in those places, it is almost certain that the number of cases would be higher, perhaps very significantly higher. So these were the right steps to take. Would we like them to have had more impact? Absolutely. We have to take a balanced judgment here, but you can't say definitely in the middle of a response whether they've worked or not. It is clear, and this is the advice that we've received, that if we hadn't taken the steps we have in some of those places, that the rate of transmission would be even higher. With respect to working with local council leaders, we work very closely with the mayors, with the local council leaders, and with the directors of public health. Today, I'm announcing further funding for them to help with their local enforcement and compliance activity so that they can take their role very seriously. Local directors of public health are intimately involved in the design of the measures in their individual area. And in fact, some of them choose to go of their own volition over and above what national government is asking. You've seen that this week in Nottinghamshire, where the Director of Public Health has chosen to implement measures which the government hasn't yet decided to implement itself. So there is a localised approach here, and that's absolutely the right way forward, because the rate of cases is so variable across the country.
And what about the evidence for the 10 p.m. curfew? Again, the leader of the opposition asked yesterday for the evidence. It's yet to be given. We know that the SAGE committee of medical and scientific advisors were not even asked to consider what the actual scientific backing would be and whether a 10 p.m. curfew would work. Talk of 100 Tory rebels, backbenchers voting against that measure next week. Possibility of Labour voting against it. Now we're told maybe a compromise of an 11 p.m. curfew. What is the evidence for either a 10 p.m. or an 11 p.m. curfew? Have you been shown any in Cabinet?
Well, I have spoken with our scientific and medical advisors, and they agree that it is commonsensical that if you've got a virus that transmits through in-person interaction, the longer that you do that indoors and the more drinks you have, the more likely it is for the virus to transmit. And as I said earlier, that's a view that's been taken by many other countries. So we're not an outlier. This isn't an unusual decision. This is one being taken by other well-informed, rational governments that have done good responses to the virus. We are listening to people's views on this, and if the evidence suggests that it's proving counterproductive, then absolutely we can change the policy.
And just finally, will there be financial help for those pubs and restaurants that are forced to close? And again, an extension targeted specifically the hospitality sector for the furlough scheme, which is due to end in just a matter of weeks?
Well, that will be a decision for the Chancellor, which I'm sure he'll take seriously, because the impact upon those businesses would be very significant and devastating in some cases. There's already significant support in place. Remember that those businesses are not paying any business rates. They have the 5% reduction in VAT, and the government has offered £1,500 per business every 3 weeks if they have to close, as well as, of course, the other payments to members of the public, like the £500 payments if you have to self-isolate. But if we have to do more, we will do, because we're very, very conscious that hospitality is shouldering a burden over and above most other sectors of the economy.
Well, okay. Thank you very much for joining us. Do appreciate that. Well, fingers crossed that we are going to see that help if we are going to have this measure. Robert Jenrick, appreciate your time. He's a Housing Secretary. Just a brief word to Steve Allen, who's been listening very quietly. I know we're late for the news, but I do want to give you a last chance to have your views on that. Do you think we have got enough of a scientific back explanation for these measures?
Not at all, and it very much feels like just using the word commonsensical to mean the shorthand for we don't have any scientific evidence behind this doesn't quite do the job enough.
Yeah, I have to say I can see the faces of everyone in my teams to go every time we heard the word commonsensical. Again, if it's common sense, then common sense is you close down the places where people are not socially isolating. Socially distancing. That would be common sense, wouldn't it?
Yeah, and if you bring in a rule that means people get together more in even worse places, then reevaluate the rule.
Absolutely. I have a funny feeling the people making the decision all have very, very huge houses with large sitting rooms and gardens and whatever. So they all socially distance when they're at home. Don't really realise how most people do actually live.